Very often we have seen young patients walking in the urology OPD with the long-standing history of lower urinary tract symptoms like going too frequently to pass the urine, poor urinary streams. Sometimes they have to get up during the night to pass the urine, and recurrent urinary tract infections. Mostly these males are 40 years and less than 40 years, mostly in their sexually active age. We call this condition as prostatitis. Now, let us understand what exactly is prostatitis. When we say prostatitis, it's a disease of young males. That means inflammation of prostate or inflammatory reaction of the prostate in the younger age. We call it as a prostatitis. Now, when we say prostatitis, it is simply infection which can lead to either inflammation, acute infection, and we divide prostatitis into many types. One is acute prostatitis, and in which the patient usually present to us with fever, with rigors and chills, lower urinary tract symptoms, burning in urination, and sometimes there can be a retention of the urine as well. We treat this condition as an acute emergency, and these patients most of the time require hospitalization, antibiotic treatment, and IV hydration. Now, in certain scenarios, majority of these young individuals, they take the treatment, and sometimes this condition can progress to chronic prostatitis. We say chronic prostatitis means that there is bacteria which is present in the prostate causing recurrent urinary tract infections of low intensity, and these patients usually have lower urinary tract symptoms like frequency, burning in urination, penile pain. Sometimes they have ejaculatory dysfunctions. They have a lot of penile pain after passing the urine, and this can also sometimes present as a painful bladder syndrome. That means they have lower abdominal pain, perineal pain. They have pain, vague sort of symptoms going to the genitalia. They may have a chronic constipation as well, and vague perineal pain which they cannot explain. We call it as a painful bladder syndrome, or a part of chronic prostatitis which affect the young individuals. I have seen in my medical practice that most of these young patients, they are very unsatisfied with the treatment because there is no one-point treatment for this particular condition. They move from one clinic to another clinic in the search of some relief, but most of the time what they need is a proper counseling, a proper drug treatment, and some extent change in the lifestyle to get them at least relieved of their symptoms. Let us understand that this disease is not actually a life-threatening process or life-threatening disease. So it is just an acute inflammation of the prostate which has a waxing and waning course. It means that sometimes these patients do better or they recover of their symptoms even without the treatment. The most important for these individuals is to counsel them properly for regarding their this condition, and if they understand that exactly what is the problem they are suffering, they definitely cope up better with this problem. So acute prostatitis can sometimes lead to really a psychological impact on the health of these individuals. So they need to be counseled, they need to be acknowledged of their problems. They need to be actually taught about the nature of the disease, what they are suffering from. Once they understand the process of the disease, majority of these young individuals, young patients do well with the drug as well as the change in lifestyle. So the mainstay of treatment remains change in the the dietary habits. Majority of drinks which they take, they should have avoid the carbonated drinks, the caffeines which are irritating their bladders, and they should do a regular exercises, especially the pelvic exercises, including the yoga to relax the perineal muscles. And they are given few courses of antibiotics on and off to tackle with the infections, and some anti-inflammatory or alpha blockers to improve their urine flow as well. So the prostatitis is very much debilitating sometimes for these younger individuals because they do not have a proper counseling or knowledge about this disease. The majority of these patients improve when they actually understand the course, the nature of the disease. They do very well. So I hope this video would be useful to understand about the chronic prostatitis. Thank you very much.